From Kern Government Television, welcome to this week's Kern County Board of Supervisors meeting, originating from the County Administrative Center located at 1115 Truxton Avenue, Bakersfield, California. Kern County's vision is to create and maintain a customer-centered county government designed to garner the confidence, support, and trust of the people we serve. Today's Kern County Board of Supervisors meeting will convene momentarily.
Okay, board to reconvene. Madam Clerk, please call the roll.
Supervisor Peters.
Here.
Supervisor Scribner. Supervisor Maggard.
Here.
Supervisor Couch.
Here.
Supervisor Perez.
Hey, good morning and welcome to the Tuesday, September 28th, 9 a.m. meeting of the Kern County Board of Supervisors. We'll begin today's meeting with a flag salute led by Supervisor Mike Maggard. Following the Pledge of Allegiance, please stay standing for a moment of prayer, silence, or meditation, whichever you prefer. First, I would like to call on Nick Cullen, Director of the Animal Services Department, to introduce our Pet of the Week.
Good morning.
Good morning, Nick. How's it going today?
It's going well. We are doing just fine.
Good deal. Who do we have here?
I have with me Larry.
Larry.
Larry's about a 7-year-old. He's an older boy, about a 7-year-old neutered, long-haired Chihuahua, maybe a little Pomeranian in him, but he's an older boy. He's been at the shelter for about a week now. We always have a soft place in our hearts for the older dogs, just because people are usually looking for puppies and kittens, and so the older dogs, we always have a soft place in our heart, and he's one of those, and we want to get him a home. So Larry's available for adoption.
Awesome. He looks like a Larry.
It fits him well.
Absolutely. Well, thanks for coming down, Nick. Okay, for our next item, we'll consider the consent agenda. All items listed with a CA above the items are considered to be routine and non-controversial by county staff. Consent items will be considered first and may be approved by one motion. If a member of the public wishes to comment or ask questions regarding an item on the consent agenda, they may do so prior to a vote being taken. A member of the board may remove any item from the consent agenda, and it will be considered in listed sequence with an opportunity for any member of the public to address the board concerning the item before action is taken. A member of the public may also comment on any closed session item. At this time, I will read the consent agenda item numbers, and that is items 2 and 3 and 6 through 8 on page 2, 9 through 17 on page 3, 18 through 25 on page 4, 26 through 33 on page 5, 34 through 40 on page 6, 41 through 46 on page 7, 47 through 54 on page 8, and lastly, items 55 through 61 on page 9. And I would also like to note that item 33 under County Council has been withdrawn by staff and will not be considered today. Is there anyone in attendance that would like to speak on the consent agenda? Okay, seeing none, would any members of the board like an item removed for discussion? If not, I would entertain a motion to approve.
So moved.
Second.
Thank you. Please cast your votes.
The motion is approved. All ayes.
Okay, next we have item number 1, proclaiming October 3rd through 9th as 4-H Week in Kern County. Is there a motion on that?
Motion to approve the proclamation.
Second.
Please cast your votes.
The motion is approved. All ayes.
Good morning.
Morning.
Maybe here. Does it ever worry you that you've put on the mask and you've turned it inside out and what was exposed to the whole world is now up against your face? I think about that every time I put this mask on. Well, good morning, colleagues. I am pleased to be with you this morning to recognize the 4-H program here in Kern County. I am joined by Cassie Smith, who, Mr. Scrivener, is a resident of Tehachapi. She's part of the Tehachapi Mountain 4-H, and she recognizes your name from the signs that were all over creation in the area up there. Also in the audience, or over here taking pictures this morning, is Sue McKinney, who is the program representative for Kern County in 4-H. So 4-H is a great program. It teaches young people about citizenship, preparation, hard work, integrity, character, all the attributes that are necessary to make someone successful in life. And I know of a number of successful and people who are leaders in our community in banking. My own wife was a 4-H member, and she led a very significant, robust women's ministry here in town. There are many, many people in our community that were 4-H leaders and then emerged to become leaders in our community. And I suspect that Ms. Smith here may be one of those people going forward. She is very active in 4-H, and I'll let her give you the whole litany of animals that she does and some of the cooking things that she does. My wife did sheep and then cooking, and did you do sheep as well? No. But what do you call a guinea pig?
A KV.
KB?
KV.
KZ?
Like C-A-V-Y, KV.
KZ. That's a new thing for me. So, but we'll let Cassie tell you a little bit more about what she is doing, and but I want to present this proclamation to you on behalf of all the members of 4-H in Kern County. So this is a proclamation from the Kern County Board of Supervisors. It's been officially proclaimed on that October 3 through 9, 2021 will be 4-H week in Kern County, and the recognition has been entered into our official board minutes, evidenced by the signature of our chairman, the Honorable Philip Peters, on this, the 20th day of September 2021. Thank you for what you're doing, for your leadership you've already exhibiting. Can you tell us just a bit about what you're doing and your role as the ambassador for 4-H?
Yes, I can. So for Kern County 4-H, I am currently the county ambassador, so I represent the county within the county, so for all of the 4-H events, and I also represent Kern County for the state as well. So personally in 4-H, I am involved in many projects such as market hogs, dairy goats, KVs/guinea pigs, rabbits, cake decorating, foods and nutrition, dogs, and shooting sports. So within 4-H, I have many opportunities for leadership, responsibility, citizenship, as well as hard work, all those kinds of things. So I do spend, I would say about, depending on the time of year, an hour to 2 spending time with all of my projects. So my dairy goats, I feed and water them every morning. I have to trim, I have to take care of all those things. And then during the year from May until September, I have a market hog, and I spend quite a bit of time working with them as well. So just 4-H is such a great program for children to learn responsibility, leadership, citizenship, how to be a productive human. I would say that it's one of the best extracurriculars that any child can do. And there are a lot of opportunities within 4-H, and it's very interesting and very surreal to see all of these kids that I've grown up with my whole life doing 4-H and all those kinds of things grow up and become very great members of society, and watching all of these young children grow up in 4-H and seeing all of the things that they're capable of. Like we had an awards night last night for rabbits and KVs, and seeing all of the kids that I've worked with throughout the year do so well within showmanship and all of those things. It's very, I don't really know how to explain it. It's a very good feeling to see all of these kids and their hard work pay off. Thank you.
That's how we feel about you. Congratulations.
Thank you.
And on behalf of all the young people of 4-H, enjoy your week.
Thank you.
Okay, thank you. Bye-bye.
Okay, so next we have item number 4, public presentations. This portion of the meeting is reserved for persons to address the board on any matter not on this agenda but under the jurisdiction of the board. Board members may respond briefly to statements made or questions posed. They may ask a question for clarification, make a referral to staff for factual information, or request staff to report back to the board at a later meeting. Also, the board may take action to direct the staff to place a matter of business on a future agenda. Speakers are limited to 2 minutes. Please state and spell your name before making your presentation.
Good morning, Chairman Peters, Board of Supervisors. My name is Francisco Martinez. I've worked for the county for 18 years. I'm a CPS social service worker and a proud member of SEIU 521. Like I said, I don't have a minute and 45 seconds is not enough to explain how negatively the county's proposal is going to affect retention in CPS. So if you want to reach out to me and have a meeting, I'm more than happy to explain it. But right now, we've been able to develop a Kern wage calculator that kind of explains at the end of the county's proposal what different people would be earning at the end of the proposal if we were to accept it that ends on 6/30/2024. For a social service worker 2 in step B, the expected hourly wage would be $1.56 less than under the county's current proposal by 6/30/2024. A service aide in step A, the expected hourly wage would be 65 cents less under the county's proposal by the same date. Behavioral health recovery specialist 2 on step B, if we were to accept the county's proposal, their hourly wage would be $1.72 less under the last best and final offer in the county's proposal. Like I said, I'm happy that some of the board of supervisors are trying to understand the proposal. I appreciate Ms. Perez last time stated that something they don't understand. Please reach out, talk to us. We can try and explain why it's bad, and that's all I'm asking is to reach out, because this is not going to address the retention issue in CPS. I'm a CPS worker, and I see the future, and it's not good under this proposal. Thank you for your time.
Thank you. Could we have our next speaker, please?
Hi, I'm Tracy Schaffner, Tracy, Schaffner, Shofner. I'm a social worker too, and have been with the Kern County employee for almost 17 years. I have not received a raise in 13 years. Recently, Ryan Alsop sent out an all-county email on the last and final proposal, which means I will make 22 cents more an hour in the year of 2022. This calculates to about 2 cents for every year that I have been in without a raise. In the year of 2023, I will receive $1.44. And in 2024, I will receive 0 increase. I can't live on 22 cents increase. I really don't understand why you're voting on this budget. I don't wear a badge and I don't have a uniform, but I do work for Child Protective Services, and that's what I do, protect children. It's embarrassing that I've invested my career in a job that does not invest back into their employees. The Department of Human Services is in a major crisis right now, and they cannot retain employees. People are quitting on a daily basis, and our workloads are extremely high, and we are overworked, and we are struggling to meet the needs of the community. All I'm asking is that the Board of Supervisors to please revisit the budget and allow a fair, livable wage and address the issue. Thank you.
Thank you. Could we have our next speaker, please?
Hi, good morning. My name is Ana Cabrera, and I'm a HST3 for the Department of Human Services. I want to thank you for taking the time out of your day to understand that your employees not only need your help, but your support. As you're aware, that Kern County employees are the backbone of this county. Without us, the county ceased to exist. We need and deserve a respectful living wage. Without us, the county suffers. So I stand before you today asking that you do the right thing for your employees that runs this county. It's the right thing to do. Thank you for your time and understanding.
Thank you. Next speaker, please.
Good morning. My name is Kern Bussard, B-U-S-S-A-R-D. I'm a legal secretary at Child Support and a constituent of District 2 and a 16-year employee of County of Kern. I'm here to address Mr. Alsup's countywide email regarding the county proposal to SEIU represented employees. Currently, employees have the ability to earn 5.11% salary increment between steps, which is merit-based for 5 years for a total of 20.44%. The county wants to take that percentage and spread it out over the new 10-step salary scale with a non-merit-based 2% COLA at each step. The COLA is not based on CPI. The percentage for the 10-step scale is 18%. Where's that 2.44% weight? The first year, they want to give us a COLA of 2.5, which is an investment of 0.06 in your employees. The total 10-year investment for all employees is 5.5%, give or take. The minimum wage adjustment is 5 years in the making, and you're starting that wage at $15.05, which does not meet the board's approved livable wage that they voted on and passed. With the wage adjustment comes class and compaction issues, with many classifications being leapfrogged by other classifications. The county not only wants to take away the employee's ability to ask for a class and comp, but wants to renege on a previous tentative agreement. Mr. Alsup, you talk about promotions. I started as an OST, promoted to an OSS, and then promoted to a legal secretary. I will not only be leapfrogged by other classifications, I will be leapfrogged by the OSS classification. How did that promotion work out for me? Thank you.
Thank you. Could we have our next speaker, please?
Good morning, folks. I'm coming to you today my name is Dr. Robert Hurd. I'm new to Bakersfield. I was born in Los Angeles. I am a 20-year Army veteran, disabled, and I am a 11-year veteran of a federal agency in law enforcement. I'm here today to support the SEIU group. Having seen some of the things that have occurred here in my 3 short years in this county, I'm a little bit concerned that these folks have gone as public employees for over 10 years without a raise. I don't know anyone in this room who could raise their hand and say that they would do that. If you, as the Board of Supervisors, weren't being compensated correctly, you wouldn't do the job. I know that each one of you sitting here loves this county because you choose to represent it. I ask that you love the workers and the people who represent this county as well. Anytime these workers can protect our children of this county, but be paid as if they were working at Amazon, these are your first responders in the homes of the people in Kern County. I think they deserve a little bit better than that. I think they really deserve you guys taking the time to really look at what they're saying. Everyone can complain about not being paid enough. That's a given. But these people protect our children. They protect the families. And whether they wear the badges or not, they are the first responders. They go into situations where there's domestic violence, and they deal with people who committed these domestic violence violations. Please give them that respect and consider what they're saying. Thank you.
Thank you. Could we have our next speaker, please? Okay, seeing no more speakers, we will now move on to item number 5, and that is board member announcements or reports. And we'll begin by inviting Kern County Director of Public Health, Brent Kerrigan, to give a report on COVID-19.
Good morning, Mr. Chairman, members of the board. As of yesterday, 787,180 doses of the COVID-19 vaccine have been administered to Kern County residents. This week, we hit a milestone. 377,182, or 50% of Kern County's eligible population have been fully vaccinated against COVID-19. Another 66,960 people have one dose of their two-dose series, meaning 58.9% of Kern's eligible population is at least partially vaccinated. 70.4% of our 65 and older population are fully vaccinated, and 35.6% of our 12 to 17-year-old population is fully vaccinated. Our average daily case rate over the past 14 days is 30.77 per 100,000 people. Just over 2 weeks ago, our case rate was 40.12 per 100,000 people. Our vaccinated average daily case rate is 1.33 per 100,000 people, while our unvaccinated average daily case rate is 49.23 per 100,000 people. Over the last 14 days, 98.33% of our cases were amongst those who are unvaccinated. Since January 21st, Kern County has had 45,077 cases, with 44,302, or 98.28%, being amongst those who are unvaccinated, and 775, or 1.72%, being amongst those who are fully vaccinated. 0.21% of our fully vaccinated population has tested positive for COVID-19. During the same time period, we've had 1,910 COVID-related hospitalizations. 1,876, or 98.22%, were in those who are unvaccinated, and 34, or 1.78%, being in those who are vaccinated. 0.009% of our fully vaccinated population has been hospitalized due to COVID-19. Kern County has identified 894 individuals who have positive tests more than 90 days from their initial positive test, meaning they likely have a reinfection. This equates to 0.65% of our residents who have had COVID-19 that have been reinfected, as compared to 0.21% of our vaccinated population who has had a post-vaccination infection. There have been 119 individuals who have been reinfected with COVID-19 who have been hospitalized during one or more of their COVID-19 illnesses. 41 were only hospitalized during their first infection. 52 were only hospitalized during their second infection, and 26 were hospitalized during both infections. Those who were hospitalized during their second infection or following development of some level of natural immunity total 78, or 0.056% of Kern County's population who has had COVID-19. For comparison, 0.009% of the vaccinated population has been hospitalized. The state's modeling appears to have tracked pretty close to what we actually experienced with both COVID-19 cases and hospitalizations. Specifically, the state's modeling suggested that COVID-19 related hospitalizations would peak at 333 hospitalizations on September 16th. Our actual peak was on September 13th with 336 hospitalizations. As of yesterday, we had 263 COVID-related hospitalizations with 74 individuals in the ICU. As of yesterday, Kern County's hospital system had 218 staffable available regular beds and 32 staffable available ICU beds. Kern's ICU capacity is at 9.3%, and the San Joaquin Regional ICU capacity is at 11.7%. Since my last update to your board, additional medical staffing resources have been secured for Kern County hospitals. Specifically, 22 more nursing staff members were acquired through staffing resource requests, totaling 90 nursing staff through mid to late October. An additional 6 strike team members, were acquired, totaling 33 EMTs and paramedics. These teams were originally deployed for 2 weeks. However, we had asked for an extension for an additional week, which they have agreed to. An additional 9-member medical National Guard team was brought in, totaling 23 National Guard members that currently remain in Kern assisting. The hospital bed capacity expansion effort was deployed here in Kern County. We added 6 additional ICU beds and 20 additional med-surg or regular hospital beds at Kern Medical, with staffing and equipment provided by the state. About a week and a half ago, the federal government reported a nationwide shortage of monoclonal antibodies, or laboratory-made antibodies that help prevent severe illness. This declaration was coupled with a pause in the ability for providers to order treatment. Starting last week, local public health departments received weekly allotments of the treatment to disperse to administering sites. We established an online process for treatment providers to submit their orders. We have received sufficient treatment to fulfill all weekly orders. The department has been working with the state to bring on 4 state-sponsored dedicated monoclonal antibody treatment sites. The allotment for state-sponsored monoclonal antibody treatment sites is separate from the local public health department allotment, meaning each state-sponsored site brings with it additional treatment capacity. The state has deployed the staff and treatment for one of the 4 sites, which is slated to open by the end of this week. There has been a substantial demand on our COVID-19 testing infrastructure due not only to the recent surge and high transmission rates, but numerous state public health officer orders and sector guidance dictating quarantine recommendations that require testing. Because of this, we have worked with the state to deploy 3 additional new free COVID-19 testing sites, one in Bakersfield, one in Delano, and one in Tehachapi. Additionally, we have added COVID-19 testing as a free service to one of our mobile COVID-19 vaccination units. On Friday, the CDC recommended a booster shot of the Pfizer COVID-19 vaccine in certain populations and for those in high-risk occupational and institutional settings. The CDC categorized the recommended booster into 2 categories, those who should and those who may. Those who should receive the booster are people 65 and older, residents in long-term care settings, and people aged 50 to 64 with underlying medical conditions. Those who may receive the booster are people aged 18 to 49 years with underlying medical conditions, and people aged 18 to 64 who are at increased risk for COVID-19 exposure and transmission because of occupational and institutional settings. Booster shots are currently available in Kern County for those eligible individuals 6 months after the date of their second dose. Kern County had 2 mass vaccination sites in our vaccination infrastructure during times of high volume vaccination efforts that no longer exist. In order to ensure sufficient capacity for vaccine booster, our department will launch a scaled down mass vaccination clinic at the fairgrounds starting October 12th. This will be a short-term clinic providing booster doses through the end of the calendar year, coinciding with the anticipated demand based on actual vaccination rates at both the fairgrounds and the CSUB mass vaccination clinic. Mr. Chairman, members of the board, this concludes my update.
Thank you very much. Are there any questions from the board? Supervisor Maggard?
Thank you, Mr. Chairman. Thank you, Ms. Kerrigan, for your report this morning. Can you tell us how it's going at the fair and giving out the shots?
Certainly. We have a booth right inside the entrance of the fairgrounds. There's been lots of interest, a lot of people stopping by, asking questions, learning more about the vaccination. We have seen people go back and get vaccinated every single day. We're also doing flu vaccinations, so people are getting either their first, their second dose of the COVID-19 vaccine. People are accessing their booster shot at the fairgrounds and also getting their flu shot.
I saw last night a repeating commercial, but I think it's a new version from the Latino Task Force featuring very prominent and respected Latino leaders in our community, David Torres, Beto Sala, Jay Tamzi, and Robin Mangren. And they were explaining the urgency to get a shot. So can you tell us where are we now in partnering with the Latino Task Force, and what do you see the trajectory of that effort taking?
Absolutely. Supervisor Maggard, through the chair, we continue our partnership with the Latino Task Force. We continue regular meetings with them. We discuss the current issues that we're seeing both through our canvassers and their efforts in the community. That partnership has been instrumental in helping us target a different audience that may not be as receptive to the government or the Kern County Public Health Department sending out a message. They continue to help us with advertising and hosting vaccination clinics. And their work has been instrumental to helping us get to this 50% fully vaccinated here in Kern County.
I particularly appreciate that they've helped the county be much more nimble in our, as we've had to pivot from one sometimes one neighborhood to another, as we have made an effort to reach the lowest performing, the most afflicted precincts, the lowest 25 quartile. Thank you, the lowest quartile. That's the word. I just think they've been very, very effective at helping us do that. So I just wanted to take an opportunity to thank them. I also wanted to thank our healthcare workers. It's a tough, tough life out there that they're having to go face every day. And someday when this is over, we think back about those men and women who went to war, America's greatest generation, and what they sacrificed to protect the rest of us. Someday we're going to look at these healthcare workers as the people who were called upon to virtually be conscripted into making a difference here. So I just want to make sure that we thank them as well. Lastly, with regard to our hospitals, how do we look as far as the peak appears to have hit? Is there another peak, another spike coming? How are we with our hospital capacity?
Supervisor Maggard, through the chair, we have seen the number of COVID-19 hospitalizations decrease rather quickly, which is fantastic. We continue to have those additional resources in the facilities to assist, because although we're starting to see decreases, the system was very taxed and very overwhelmed. So we need a little more progress under our belt before we start releasing some of those resources that we currently have in here. It's very difficult to estimate if we'll have another surge or not. If we continue to see variants, it could be likely that we'll see a fourth surge. I think we've learned a lot from this previous 3 surges. Every new surge we have, we add more to our plan so that we're even more prepared for the next surge. So we'll continue to work on being prepared if a fourth surge does come.
Thank you. Last comment. This has to do with why we hope that people will become vaccinated. At first it was suggested to us that this will prevent the disease and it'll prevent spreading it. Well, it appears that it continues to spread. But the second reason that I know that we want people to become vaccinated is it helps them when they become ill. If they are reinfected or have a breakthrough case, they are not nearly as afflicted as they would have been otherwise. Can you speak to what level of illness and what ravages we see on those either that have been vaccinated or those that have not been vaccinated as they catch the disease going forward?
Absolutely. Supervisor Maggard, through the chair, part of my presentation every time I come before you guys is to definitely break down the difference between the illness in those that are vaccinated and unvaccinated, and the illness is substantially higher in those that are unvaccinated, including hospitalizations. We see very little hospitalization in those that are vaccinated, and we haven't seen any deaths in those that are vaccinated to this point. So all of our over 1,500 deaths that we've seen have been in those that are unvaccinated. So the vaccine is essential in helping us to prevent that severe illness and death in our community.
Well, thank you, Ms. Kerrigan, for your report and for the diligence that you and all of the crew that you work with every day. You're there making sure we're protected. So thank you. Thank you, Mr. Chairman.
Sir, Supervisor Scrivener.
Thank you, Mr. Chairman. Ms. Kerrigan, good morning. Thank you, first of all, for your report. And once again, if you could provide that to us in writing, that would be great to have all those numbers. But one of the numbers that you mentioned that I think I picked up correctly, and I'm going to ask you, is our hospitalization capacity right now. Did you say 9% in Kern and 11% in the Central Valley?
Supervisor Scrivener, through the chair, that's correct, in our ICUs.
So that's the first time that I can remember where Kern had less capacity than the Central Valley. Is that right?
That's correct.
Do we know, or do we track rather, how many of our hospitalizations are from folks that are out of county? I think that for the last several months, we've been required to receive patients from other counties via the state's mandate on that. Do we track that number at all?
Supervisor Scrivener, through the chair, we track if a requested transfer of a patient comes through our system to transfer that patient in from a hospital outside of our community into our community, but sometimes those transfers happen from hospital to hospital, so we aren't aware of all of them.
So we don't know the extent to which our numbers are being impacted by folks coming from the LA Basin or from the northern parts of the Central Valley or otherwise?
Correct.
Okay, is there any way for us to drill down and determine that? I mean, how difficult would that be for us to get some idea? Because I'm just wondering if we have some indication that maybe Kern is faring less well than some of the other areas of the Central Valley, which wouldn't have been the case up until now if you're looking just at hospitalizations.
Supervisor Scribner, through the chair, I'll figure it out.
Thank you.
Sure.
I have faith in you as always. Thank you so much.
Thank you. Supervisor Perez.
Hi there, good morning, and thank
Hi.
you for your hard work. So supposedly I'm the chair of the Latino caucus, but I knew nothing about what Mike just referenced, and I'm almost out of the loop entirely about what's going on there. So I'm curious if you or Mike know why, as the chair, I wasn't invited to have the conversation or partake in it, or frankly knew nothing about it. Maybe I've just been out of the loop. I don't want to be, too paranoid, but I didn't know any of this was going. I'm supposed to be the chair of this organization, and I'm just unaware of what it's doing.
Supervisor Perez, through the chair, I cannot provide you an answer as to why you were not included.
Thank you. Mike, do you know?
I do not, but I think the Hispanic Chamber is taking the ball and sprinting forward with it, so.
That makes sense. Thanks. Appreciate it.
Thank you. Any other questions from the board? Okay, thank you. Oh, Supervisor Baggard.
I have something to ask about, not related to COVID.
Sure thing.
Is it okay to do that now?
Yep, go ahead.
Okay, thank you. This is not a criticism of anybody in the county. I'm hoping that we can kind of initiate a discussion about another issue that needs a solution. There's a residence there was a residence at 220 Decatur in Oildale. We followed all of the protocols to make sure that it was posted, that we have gone through the process of evicting squatters that were in the property. But even though it's posted, even though we've done all those things, it burned to the ground 2 nights ago. And 15 feet away from it, it isn't just some old dilapidated house that burned to the ground. 15 feet away from it is a bedroom of somebody's child who, was 15 feet away from a house torching off in the middle of the night. I just want us to come to a point that we draw a line in the sand and say we're not going to tolerate squatters burning up our neighborhoods and endangering our homes any longer. Both in the county and in the city, the incidents of fires and being started by squatters and vagrants, it is replete in those numbers. So what I would like to ask this morning is, and I saw our fire chief was here, but he is not here at the moment. I'd like to have our fire chief, Aaron Duncan, our county counsel, somebody from the head of our code enforcement division come together and let's talk about, this isn't a problem that's just happening in Kern County, just in the city of Bakersfield, it's happening all over the place. There must be something we can do different because what we're doing, in spite of our best efforts, is not working. So could I just make that referral in general this morning, ask them to come meet with me, and let's have a roundtable discussion. And Mr. Alsop, you're alerted and up to the microphone. Are you wanting to say something about that, sir?
No, sir.
We were not. Okay.
I will do that if that is your request.
I appreciate that, and look forward to having that roundtable come together. And we're all intending to do the right thing, but we just need to think about it a little bit differently. So thank you, and I appreciate everybody's cooperation in that.
Thank you, Supervisor Maggard. Any other questions or comments from the board? Okay, seeing none and having no more items to consider in open session, I'll entertain a motion to adjourn to closed session to consider item 41 under the County Administrative Office and items 62 and 63.
So moved.
Excuse me, I had that backwards. 62 and 63 under the CAO's office and item 64 under County Council. Okay, and without objection, we're adjourned.
Although we were ready to face any mission, help those in need, and make a difference, for some of us, coming home was more of a challenge than we expected.